So yeah, if you're currently experiencing pain during running, obviously we need to think about the mechanics of what a run actually is. So if you're using tools like static stretching, where we're thinking about getting length in the quads and opening up the hip flexors, that's unfortunately not going to be the right answer in terms of getting you out of pain. What we need to think about is what the mechanics of running actually is, and that's a series of single leg landings at mid-range knee bend. So when we think about going through a run, we want to think about roughly landing at mid-range knee bend, and we want to think about connecting the dots from the floor up through that chain, or the kinetic chain. We need to think about ankle and foot mobility and movement quality, patella tendon health and knee health, and then obviously thinking about getting the hips to flex and extend in a clean manner relative to the rib cage and the pelvis. So we really need to think about spreading force across that whole chain, rather than sitting and holding passive stretches and doing yoga to offset what the pain actually onsets with, which is running. So if you're getting pain during that run, we want to think about spreading force evenly. If every time you run you get knee pain, we know that's obviously the area what's giving symptomatic feedback, but we want to think about not just hammering the knee forever with rehab. We want to think about getting the hips and the ankles involved so we can spread force across that chain. As we were saying earlier, a series of single leg landings at mid-range knee bend. So when we're striking the floor, we need to be able to absorb force evenly through that chain. And then when we push off the floor to translate onto the other limb, we need to be able to produce force evenly. If we're really leaky through the knee, and that gives us pain and symptomatic feedback, we address that area first, but then heading into late stage rehab, we take a whole body approach to make sure that you can perform and stay out of pain for long term.